Hello, everyone. Good morning, or good afternoon, or maybe good evening. So today I'm going to deliver one of the most important topic in this course, health behavior. And then we're going to understand how our daily actions and lifestyle choices can affect our overall health and well-being. So without further ado, let's just go jump to the next slide. So the content outline for these presentations is that we are going to understand what is the definitions of health behavior and health risk, and then what is the determinants of health behavior, and then maybe we will also talk some of the theories about health behaviors, what is the typical motivations and learning outcomes from practicing health behaviors, and then what is the factors influencing motivations and learning, and then what is actually our roles, especially nurses, in promoting health behavior, in our patients, for example, or even in the community. Right. By the end of these presentations, my learning outcomes is that at the end of the chapter, the students should be able to, for example, you can demonstrate and also you can understand the terms or the definitions between health behavior, health motivations, and learning. And then you can also understand or describe the importance of motivations and learning in health behavior. And then you can also discuss with, your friends or your colleagues or your peers or your classmates, what is the importance of nurses' role in health behavior changes, right? Okay. Now, first of all, I'm going to tell you the definitions of health behavior, a little bit introductions about this course. So, health behavior actually refers to the actions of individual, in this case, is patients, for example, to take actions that could affect their health positively or negatively, right? So these behaviors can include, for example, diet, such as what kind of food they eat in daily life, and then exercise, whether they, do physical exercise every day, or do they smoke or not? Do they use a substance use, and whether they, healthcare settings action, right? And then by understanding this health behavior, it is very important, or it is essential for us as a nurse, because it influence to the patients directly. How can they manage their health, and also how can they respond to the treatment, right? So this is just some pictures that show some health actions that could refer to our health in daily basis. For example, cigarette, or here you can see eating fast food, for example, or here is inactive lifestyle, for example, and then here is consuming alcohol, right? And then now I am going to introduce you what is the difference actually between health behavior and health risk conceptually. So here, as you can see, the health behaviors is an actions or actions individual take to maintain or to improve their health. Meanwhile, health risk means that all actions or factors that could increase, or they could improve their chance of getting illness or injury. And then in health behavior, that includes, for example, healthy habits like doing exercise or workout, or eating balanced diet, you know um, avoiding smoking. And meanwhile, health risk is totally the opposite side. For example, smoking, physical inactivity, or poor diet, and using substance use, right? And then here, the health behaviors is mostly influenced by our physiological or social factors means that, our own body and our mindset, and of course social factors like, our family or our friends. And the other hand, health risk is mostly contribute to the development of the chronic disease. So the more we, practice a health risk, the more we get a chance to, get a chronic disease as well, right? Now, I'm going to introduce you what is the key to practice health behavior. So first of all, set goals surrounding healthy stress management. What does that mean actually? So by practicing a good stress management, it could definitely help us to be, physically healthy and also mentally, healthy as well, right? And then we can also incorporate many physical activity into your daily life. For example, instead of, taking bus from LRT stations to your class, you can actually also choose to, walk in the morning, especially if the weather is not also too hot yet, right? And then the third one is that we can also create a good and healthy habits around bedtimes and sleep. So it is essential for us as a human to have a, enough sleep and then a regular sleep. And then if you can also do that, you can also, set an alarm every day, and then, trying to not to stay awake until late, like every day, right? And then the third one is that you can actually also start to begin every day with an activity that you could enjoy. For example, some people might enjoy reading books or magazine in the morning, or maybe some of you likes to enjoy reading newspapers, for example, or it can be also, enjoying by watching some videos or, exercise in the morning. That is also good to, promote a healthy behavior. And then be intentional about work-life balance, right? So as a students, for example, work-life balance can also means that, between your uni life and your personal life should be balanced. So you shouldn't be too stressed about assignments, for example, or homework, for example. And then you can also actually also enjoying your life outside university. For example, your social life, right? So having engagement with your friends and something like that. And then the last but not least is that practice gratitude. I think this is also one of the most important things for us in order to keep, maintain our healthy behavior. Practice gratitude. So being grateful for whatever you have in your life. Now, I'm going to show you some of the example of the healthy risk. So previously, I have shown you the health behavior, and then now I'm going to um, um, introduce you some of the examples of the healthy risk. So the first one is that consuming alcohol and substance use. So from the pictures, you can see here a lot, for example, for example, here, smoking cigarettes, for example, or, taking some tablets, for example, and then one of the advantages it can develop, for example, for your body is that you can damage your organ, especially your liver, right? And then there could be some an addiction risk, and then poor judgment and poor coordinations due to the side effect from this, substance use, right? And then the next one is that poor sleep. So what does that mean? So I mean, poor sleep is that if you cannot manage your sleeping and then you stay awake every night, right, for a long period of time, so it could affect your body, and then it could, affect your energy. So having always low energy, and then it could also weaken your immunity, and it could change your mood by the time, right? And then the next one is that stress. So having a high stress in a longer period of time, it could also affect your body, especially your blood pressure. So the next one is that, of course, having stress could, you know, make you feel anxiety a lot and also fatigue. And also it could weaken your immunity, right? And the next one is that smoking and tobacco use. So this is actually one of the most common in our society. Um, People are smoking, and then the majority of them know about the effect side of tobacco smoking, but still the number of smoking not only in Malaysia but worldwide is still high, and then that makes sense why the lung damage percentage is very high, or even lung cancer, and even like premature aging, right? So people could aging easily nowadays. And the next one is that sedentary behavior and activity. So what does that means is that if we practice an active lifestyle, do not really move a lot every single day and trying to just choose to stay at home, so that could help, not really help, that could make us gain weight easily, and then that could weaken our muscles as well, and then that could also very easy for us to get like heart disease. Yeah. And then the next one is that poor nutrition. So consuming a lot of junk food, for example, or even, lots of sweet food, for example, and every day, that could make you, to develop a low immunity. And then, of course, also a deficit nutrients, and also that could, you know, contributed to developing a chronic illness, right? Now, I'm going to explain it to you. What is the determinants of health behavior? So, as you can see in my screen, there are actually some factors for you um, uh, to practice a health behavior. So, the first the first factor is that the first factor that determines you to promote health behavior is that the individual factors. So what does that mean? So the individual factors is that is a factors that personal or individual characteristic that directly affect your person's health choices, right? So what do you eat every day? What do you drink every day? Do you smoke or not? Is it totally in your hand? You decide it. This factor comes from you as an individual, right? And then the second one is that environmental factors. So environmental factors means that there are actually some physicals and buildings in your surroundings that could shape you to choose health decisions. So people who lives in such poor sanitations, for example, that could contribute to them to having, or making a healthy behavior. Is that, what does that mean? So let's just compare between people who lives in a good sanitation's house, also versus people who lives in a slum area, for example, right? So people who choose to live in a better environment, so they can get a better access to um, clean water, for example, and then better sanitations, for example, compared to the people who lives in a slum area. So the next one is that economic factors. So economic factors is also one of the primary determinant of healthy behavior. So it can be saying that the economic factors also playing a significant role in shaping a person's health choices and overall well-being. So people who lives in a low income country, for example, versus people living in the middle income country or high income country. So you can see the difference, how the people's there, how their daily lives there, where they can usually get access to um, clean water, for example, right? And then the next one is that social factors. So social factors means here that it's a factors that is coming from, the persons you are having with, what I mean is that, for example, your friends, or your families, or your peers, and something like that. And it's these relations with the community and also the cultural backgrounds and the in general. So people used to say that if you're making friends with people who likes to do exercise, that could help you as well to do exercise as well. And then at the same time, if you're always making if you have a friend, if you have friends who always spending time in at home, for example, and eating junks, I think more or less you can also have this kind of behavior, or it can help you to develop, to contribute to develop this kind of habits, right? Okay. So the next slide, what I'm going to deliver is that what is exactly the key determinants. So this is just another explanations from a previous slide, the determinants of health behavior. So it's actually the same, but give us a different example. So such as here, in individual factors that includes our knowledge and beliefs about health, and then how our skills and abilities also influence us to practice a healthy behavior, how we really believe about healthy behavior that includes, our self-efficacy, and also more or less our genetics and our biology factors will also contribute to this healthy behavior. And the second one is the environmental factors. So this means, for example, how we build the environments, our house, for example, our garden, for example, how we work and school, how is the work and school environments, for example, do we really have a good friends, do we have a good relationship with colleagues, or out with our friends, our classmates, for example? Do we have access to the resources, for example, if we have a problem with mental health, for example? And is there any pollutions and safety issues in our environmental surroundings? And the next one is that the social factors. The social factors is that how we can also have a resources to our peers, for example, or to our classmates, for example, to our family. If we have friends related to, our assignments, for example, is there any resources to get help from them, right? Or to our professors, for example. And then the work and the social environments looks like, and then the same access and resources and pollutions and safety. It is pretty much the same like environmental factors, right? And the next one is the economic factors, such as your income and wealth from yourself or from your family, and then are you employed or unemployed? Do you have occupations or something like that? How about your education's background? Because nowadays we can definitely see the difference significancy between how really behave between people who have a high education background compared to the other side, right? And also cost of living, for example. Now I'm going to introduce some of the theories that related to the healthy behavior. Here, what I'm going to explain it to you. What is exactly some of the theory behind why we want to practice the healthy behavior. For example, right? So the healthy behavior theories provide a framework to understand and to explain, also to predict how people behave in relations to their. So this is why we need theory, right? Because theory essentially provide us how can we understand, and also theory, help us to explain, and the theories also help us to predict, how people or our patients in the hospitals behave in relations to their health and well-being. And then by trying to embed a theory into healthy behavior, we can also understand what kind of determinants that happens in our society that could influence them to practice a healthy behavior, because theory will also help us to guide and to design some of effective interventions for our patients to promote positive health actions and prevent illness, right? And then the theories generally fall into three categories. There are some theories in individual level, which is mostly, focused on personal thoughts, for example, beliefs, for example, and attitudes. While there's also some theories that, stays in interpersonal level, right? And this kind of theories actually consider such as social influences and our relationship with, our other humans, for example. And then the next one is that theories that stands in a community level. So this type of theories help us to examine how socials and politicals and environmental factors could affect our health, right? So this is some of the example of the theories that I mentioned before. In individual level, right? And in interpersonal level, and in the community level. So let's take a look, first of all, in individual level. So in individual level, we have some theories, for example, health beliefs theories, or theory of planned behavior, or also stage of chance or trans theoretical model. So health belief model, I'm sure you have been hearing this kind of theories. So health belief model is exactly a theory that believes that an individual's perceptions of threat of a health problem and the appraisals of recommended behavior for preventing or managing this problem. So if someone's belief that smoking could change their lungs into, having cancers, for example, so this could help us to avoid smoking, for example. But, as you can see in reality, even theories state that, but in reality, sometimes do not really predict, concretely, right? And then the second one is that the theory of planned behavior. So this kind of theory of planned behavior means that individuals' behavior or your patient's behavior intentions is the most factors or the most important determinants of your behavior. So there must be some intentions first in yourself. So in order for you to change or to practice a healthy behavior, right? And then the third one is that stage of change or trans theoretical model. So in this model, explains that an individual readiness to change or attempt to change toward healthy behavior. So in this trans theoretical model, explained it to us how individual would change their habit, one habit, for example, from unhealthy habit to change to healthy habits. For example, we want to know if our patients or if our interventions could really improve our patients to quit smoking, for example. And then we would like to give them some, health promotions, for example, right? So in the first stage, probably these patients will resist to change. And then the second step, they will start to think about it. And then that's the second stage. And then the third stage is that they're going to, so after resist, thinking about it, and then trying, and then, keep, after they try to quit. And then after that, the next stage is that try to maintain this, trying to quit smoke. And then the last one is that totally change the smoke. So this a trans theoretical model provide us a good example how people can change their behavior from the beginning until the end. The next slide, I will probably explain it to you more, right? The next one is that in interpersonal level, such as a social learning theory. So in this theory, they explained it to us that behavior is explained via 3 ways. What ways is that? The first one is through dynamic reciprocal theory, in which personal factors, environmental influences, and behavior continually interact. So these type of factors actually, contributed to us to promote a healthy behavior. And then the next one is at a community level. In a community level theory is divisions of innovation theory, where this theory explained it to us that addressing how new ideas, new products, and social practices spread within a society or from one society to another. So let's say if we heard about, mask actually, so there's a, people heard that mask actually could prevent us, let's say 60% for having flu. And then I believe the theory also say the other, individual will also follow this same, wearing mask. Right. So this is some of the example or the deep explanations from all of the theories that I mentioned before. Health belief model. So the health belief model is founded by 2 very famous guy here, as you can see here in the picture, right? Hochbaum and Rosenstock in 1950s. And then the health belief model is actually one of the oldest, right? One of the oldest and the most widely used model, especially in the health related research or the health related theory. So as a nursing students, you have to be familiar with this theory as well as their founders, right? So health belief model, as I mentioned before, suggests that a person's readiness to take a health-related actions is based on their perceptions of the health threat and the value of taking actions. The second one is the trans theoretical model, or TTM. So the founder of this theory is James Prushenka and Carlo Di Clemente. The theory is developed in 1980s at the University of Rhode Island. So this theory also known as the stage of change model. So as I mentioned before, right? So this trans theoretical model stage, a trans theoretical model teach us how usually, people usually, change. They're trying to explain stage by stage. Like here, in the pre-contemplations actions, usually the patients still say no. They don't want to quit smoking, for example. And then after we give them some, health promotions, for example, or health interventions through health promotions, and then their contemplations, they're going to the contemplation stage, right? And then they probably think, maybe I'm going to change, maybe not. And then after that, after pre-contemplation stage is preparations. And then in this stage, the patients usually will prepare how to quit or how to stop smoking. So they start to plan for that. Let's say this individual start to throw away their cigarette, for example, right? And then the next stage is an action. So do. So they start to quit in the first day, and then maintenance stage. This is the last stage of a stage of change based on the trans theoretical model. So in the maintenance stage, so usually this individual or these patients, trying to quit their smoking in the second day, for example, and then moving to the third day, and then moving on the fourth day, and then so on, and then so on, right? Right. So the next one is the theory of plant behavior. The founders is Echek Adjans in 1980s. So this theory of plant behavior also helps us to understand how this theory, explain that the most important determinants of person's behavior is actually their behavioral intentions itself, right? And then intentions is a person's conscious plan to perform a specific actions. So if someone's want to change to, if someone want to, plan something, right? So the first component is that has in someone's or in one individual is the attitude, and then their subjects to norm. Is it, supported by norms, for example, or against, maybe? And then the other one is the perceived behavior control. When all these basic components is there in one patient, for example, this could, lead these patients to have an intentions to quit smoking, for example. So after they have an intentions, then it become an actions, right? Through their behavior. So it can be directly from here, perceptions of behavior control without any intentions, and then, however, they can practice it directly without any intentions in previous stage. The second one is the SCT, or social cognitive theory, founded by Albert Bandura. He's very, very famous. As a nursing student or a nursing scholar, you should know this, right? As its SCT tells that this theory explains a comprehensive model that emphasizes the dynamic reciprocal interactions among personal factors, for example, cognitions and emotional and environmental influences, such as, social support, physical setting, and behavioral etc. So now I'm going to introduce you that the healthy behavior itself, there are basically two concepts to change or to promote or to practice health behavior. First of all is an intrinsic motivations, and then second is an extrinsic motivations. So persons or individual or your patients would like to change their, bad habit, for example, it has to be coming from two or one of these two factors, whether from intrinsic motivations or extrinsic motivations. So what does that mean? So in intrinsic motivations is an internal or coming from our internal drive that engage in a behavior because it is personally rewarding, right? So you are going to do something because you want to do that. You want to quit smoking because you realize that smoking is one of the unhealthy behavior, right? And then the second one is that an extrinsic motivations. What does that mean? So an extrinsic motivation is exactly coming from outside, from your environment, from your surrounding. So a desire to perform a behavior from external rewards or to avoid punishment, right? For example, a person might start exercise to lose weight because they want to, present in a wedding or to get a compliment from a friend. So get back to the smoking behavior, for example. So one of the extrinsic motivations from from one person to quit smoke, for example, because their girlfriend did not simply comfortable with persons who smoke. So this guy maybe think that, okay, I'm just gonna quit I'm just gonna quit smoking because my girlfriend don't really like it, right? And then in intrinsic motivations, for example, again, this is just an example. A person's exercise because they genuinely enjoy the feeling of being strong and energized. And then this type of motivations is often one of the most powerful because long-term behavior change. It can promote a long-term behavior change because it's coming from ourselves, right? It's coming from, an intrinsic motivations. And meanwhile, in extrinsic motivations, it can be like less sustainable because, it's not really coming from you. Rather, you are motivated by persons, right? So that doesn't really, stay longer in some person. For example, this guy, so he promised to his girlfriend that he wanted to quit smoke because they are in a relationship. But once they, broke up, so this guy could be, back to smoke again, right? Now, I am going also to explain a little bit about how do we learn healthy behavior. So, sorry. So, learning about practicing healthy behavior can be from, acquisitions knowledge. So what does that mean? So through knowledge acquisitions, for example, we can learn facts about, healthy lifestyles, such as, trying to understand the relationship or the link between high cholesterol and high disease, or the calorie contents of different foods, for example. So through learning, through reading articles, for example, we gain knowledge, and then that could, essentially, help us to understand how cholesterol, for example, or how inactive lifestyle could, you know, contributed to ourselves to gain weight a lot. So through learning, through reading, for example, we gain so much knowledge, and that could help us to promote, or to practice a healthy behavior. And then through skill development, right? So learning the specific actions required to perform a behavior, such as how to prepare a healthy meal, using a blood glucose monitor, or properly perform an exercise, right? So through developing a skill, for example, how can we prepare a good meal, for example, so this kind of skill can be developed so that can we promote a healthy behavior. And then the next one is that attitude formations. So one of the key that we can use to learn healthy behavior is that through learning how we can develop a positive attitudes towards a new behavior. So hopefully this can help a person's, or probably also your patients, or your family, to overcome an initial discomfort or skepticism, right? Now, I'm going to explain a little bit the intersections between how motivations and also learning can intersect each other. So these two concepts are actually, intertwined together deeply. And then a person's actually must first to be motivated to learn, right? Because if they don't really motivated, and so how they can, trying to practice a healthy behavior. And then by having motivations, we can also process, go through learning process and can strengthen their motivations. So between motivations and learnings is actually two different concepts, but they can, intertwine together, right? So they can promote together, as you can see here in the picture. So the motivation through internal drives and also learning here through gaining knowledge, gaining skills and experience. So these two factors could contribute a lot to, ourselves or our patients, to practice a healthy behavior. So the next one is that I'm also going to explain you about what is actually, factors that you can that can influence you to be motivated and to learn a lot about a healthy behavior. So this includes factors that influencing motivations and also factors influencing learning. So some of the factors that influencing your motivations to promote a healthy behavior is that it has to be, first of all, your personal needs, you know, you also have your own goals, and you also have some kind of like a desire, right, to improve your health and to improve your appearance, for example, and maybe to have a good quality of life, right? So you want to look fit, for example, so you decided to go exercise, and then you want to improve your health, you decided to go exercise, to walk outside because you feel like you are tired every day with just staying at home, right? And then the second one is healthy beliefs and your own attitudes towards, healthy. So having a good confidence and having a good attitudes could, definitely give you a lot of benefits toward a healthy behavior. It is actually similar with the concept of self-efficacy, right? And then the third one is on emotions. So if you have a good positive emotions about, healthy, you have pride, and then you have also encourage, you have a good um, actions, you always encourage yourself to do exercise, to quit smoking, for example, to stop, eating junk food, for example, every day. So that could also give you some good motivations to practice health behavior, right? And then, of course, rewards and incentive can be also a good things for promoting a healthy behavior through recognitions, for example, prize, for example, or tangible benefit, such as, giving a good, a prize, or we recognize to our friends, give them some motivations if they lose some weight, for example, because they have been doing exercise a lot. So I think that's good things to help them to be keep motivated. And then also social groups, right? Through encouragement from your friends or your from own family or even your own community. And then some of the factors that also could influence you to learning is that um, first of all, whether you have a good or previous knowledge and experiences about, certain types of health issues, I would say. And then whether you have a post exposure that could help you to understand about this new concept. Um, Maybe before you get diabetes, for example, you do not really know how to manage that, and then you keep keeping a lot of sugars, for example. But now you develop diabetes, for example, now, and now you're trying to manage your daily life. You can trying to control your your sugar intake, for example, in daily basis. So by this situations, you can actually also help you to learn a lot, and then you try to manage through better healthy lifestyles, right? And then the second one is the readiness to learn, your willingness, whether you are open minded to gain some new knowledge, new skills, right? And then through learning environments with, such as a safe environment, comfortable environment, and then resourceful settings that can help you to, improve your learning. And then teaching methods as well, such as, an interactive class with your friends, with your colleague, or with your peers. A clear and a relevant strategy can be also very effective for you to learning some, new skills to promote a healthy behavior. And then some also things such as cultural and language considerations can be also one of the motivations to learn, right? So, uh, so the next note that I'm going to explain it to you is that what is exactly our roles, right? As a role as a nurses, right? In promoting this healthy behavior, right? So imagine you are a nurse at the moment, and then you want to give some health interventions to your patients. You're working in the hospitals or in clinical settings, for example, and then you decided after consultations with your friends, right? And then you want to give them some health education to your friends in order to promote a healthy behavior. Um, yeah, I'm having class. All right. So the first one is that as a nurse, our roles is that, of course, we are also an educator, right? So as a nurse, we also provide our patients with lots of knowledge they want, a lot of knowledge they need in order to, to develop their skills and to be informed so that they can make a healthy decisions about themselves, right? So this include, for example, how we can explain the importance of a balanced diet, for example, how they can manage their food every days, and then how they can practice a regular exercise every day, physical activity, and then we can also give them some health educations about the dangers of smoking, for example, how the excessive alcohol consumptions it is, and then how necessity of managing stress as well. So these kind of things is part of our roles as a nurse, right? And the second one is we as a nurses is essentially also as a counselor or a coach for our patients, right? So nurses mainly guide or support our patients or our individuals through the process of changing their behavior. So by using, various techniques like motivational interviewing, right? These could essentially help them to explore their own motivations, and then they can help to identify themselves by overcoming barriers, and then so that they can also set realistic goals and achievable goals from themselves, right? So that is one of the nurses roles as well in health promotion, in health behavior. And then the next one is that nurses also playing as an advocate for our patients. So nurses advocate for their patients by ensuring that our patients have a full access to the all resources and support they need to maintain their lifestyle, to maintain their healthy lifestyle, right? So one of our tasks as an advocate is that we can actually, we can also help them to trying to connect them with their own community program, right? We can also help them, provide them a social services or even like a social support groups for our patients. In a broader sense, for example, nurses can also advocate for a public health policies, for example, that could support the whole, well, healthy and wellness and create a healthier environment for our patients, right? And the last one is that the nurse's role is that, of course, we as a nurses not only just um, taking care of patients in bed or in hospital, for example. Rather, we also as a role model, right? Nurses actually or essentially serve as a role model for their patients or even their community, right? So by demonstrating a healthy behavior in their own life, that could give such a prime example to manage stress, for example, staying active, for example, so that our patients can also follow what we are doing, and then they can lend credibility to their health and promotions messages. So, so the conclusions of our class today, right? So, healthy behavior is influenced by lots of factors, by complex factors, and it's actually through a complex interplay between, their own personal belief as an individual, right? And also coming from the other factors, such as our environmental factors, in this case, social factors, and our also environmental influences, right? And then in healthy behavior, also supported by lots of theories and model, such as, healthy belief models, terms theoretical model, and then theory of plant behavior. So this model or this theory could actually help us to understand or to explain how this framework, how people, can, trying to promote healthy habits, for example. And then us, nurses, and probably other healthcare professionals essentially plays a critical role in applying those models to design an effective and a tailored interventions so that we can help our patients to educate them and to empower them to make a healthy, good decisions, right? And then last but not least, promoting health behavior is not just about, providing information to our patients, for example. Rather, we also help them to address their personal readiness, right? Or even their perceived barrier. We can also explore that area. And then, some of the social context so that, they can facilitate them to promote a healthy behavior. So I think that's all. Thank you very much for, listening my class today. I hope you can learn something new from today. And if you have anything to ask, if something is not clear yet, feel free to replay again the part that you don't understand, and you can try to listening again. However, if you still feel like this part is not clear enough, you can definitely come to me or text me or email me, and I will try my best to, to help you to understand. Right? I think that's all. Thank you very much, and I'll see you guys around.